There are specific channels on YouTube by the name of Blue Way or Cocomelon also that they actually shoot the entire content in such warm tones and such warm shades, which is very tempting to babies and kids.
That is something called dopamine trap. It is good to get infection, so by which the baby develops immunity. So it is okay to get the infection like every 2 months once or 3 months once.
What are the red flags in child development that parents should look out for?
If there is like no visual fixation by 2 months of age, and there are no vocalization, if the baby is not able to say any sounds, not able to make any sounds by 6 months. And the third one,
Do you really think baby walkers actually help kid to take their first step and actually help them walk?
no, I'm totally against.
Hello and welcome to another exciting episode of the Paalan Poshan podcast presented by Baby Forest. In this episode, we share valuable insight on newborn care and practical parenting and wholesome nutrition for your little ones. Today, we are thrilled to welcome Dr. Ajay Prakash, an experienced pediatrician with over 7 years of experience in child health. He is known for his expertic pediatric care and his award-winning research on how screen time affects language development. Welcome, Dr. Ajay Prakash. Welcome, Dr. Ajay Prakash. Thank you so much for accepting our invitation, and you are flying from Chennai just because to come over here. It's really going to be helpful for all our community and users. So shall we start?
Yeah.
Yeah, okay.
Thank you for inviting me.
The pleasure is all ours. Dr. Ajay, we have been following you over the Instagram, and you are the most entertaining yet informative yet educated pediatrician over the Instagram, and we loved your content. However, we also trying to help our community and users to give them such insightful education and knowledge about health and nutrition for the babies. We want to educate them about the development of the baby. So that is the reason we have started this entire podcast and journey towards our community and towards our user. And I hope it will definitely help
Yeah,
them.
this is a very good initiative by Baby Forest. I'm
Thank
very
you.
happy to be part of this.
Thank you so much, Dr. Ajay. Pleasure. So, we understand a lot of things when it comes to infants, baby, and toddler. There are so many nostalgic abbreviations from mothers, from grandmothers also. They do not even understand that the society has been changed, the culture has been changed because we are living in the era where if you talk about specifically Delhi, a lot of smog is there, air pollution, noise pollution, there is no in terms of hygiene, there is no, a remarkable structure as of now in every metro cities in India. However, we are still looking forward to give, a right upbringing to children, a right environment to children, but still it's difficult to navigate that. Coming to the climatical condition in India, not everywhere in India there is a winter, but I think in North winter is approaching and it's already here. So we are very skeptical as a mother also, because I'm a new mom. What are the new, what are the help you can give to a new mom for the right winter skincare tips, winter skincare essentials? So if you can advise us.
Yeah, as far as the winter is concerned, usually babies get a lot of dry skin and itchy skin. So the skincare is very important in winter compared to the summer. So as like before, we can do a pure coconut oil massage for the babies for 10 to 15 minutes before bathing. So and then we should bath the baby not more than 10 minutes. And after bathing, we should gently dab the baby with the towel. We should not completely dry the baby. And immediately we should apply a good baby moisturizer like toxin-free moisturizer or a baby cream or a lotion which is toxin-free and safe for the baby, and strictly no powders.
Okay.
Apart from that, so other things which is not only particular to the winter, which is like any other season, there should be a proper balanced diet and adequate water intake.
Okay. So adequate water gives hydration to baby's
Exactly.
skin.
In summer, we used to have that quench to drink water, whereas in winter, the kids never drink water unless otherwise they're very much thirsty.
Yeah.
So it is our duty to give them a good amount of water in any form, like even fresh juices or tender coconut water in any form.
So water intake is must in
Exactly.
winter also. I mean, people do think that if it is winter, you correctly mentioned that in winter the intake of the water is very less.
Yes.
So we need to find out ways to actually let kids drink the water. Through maybe smoothies or through coconut water, through like whatever. So it's essential a proper
Something
hydration
naturally
in
made,
winter
yeah.
also. Okay. Okay. However, moving forward, you mentioned coconut oil. There is a myth so much in the society, like if you use olive oil on baby's skin, the skin start penetrating into the lighter stones. Is it true or false?
So, to be frank, I don't believe in all these fancy oils from the foreign countries. Even the recent scientific researchers from United States and UK states that coconut oil is best for the babies. Even in NICU, like for the low birth weight babies and preterm babies, we are using coconut oil massage for the muscle to grow. So it is scientifically proven. We don't need any fancy oils like almond oil, olive oil. So we have a very good coconut oil from our own roots. So we can make use of it.
I think a good cold pressed coconut oil works
well,
wonder.
exactly.
Yeah. Okay, okay. Moving forward, doctor, skincare tips, you clearly mentioned that we should do a massage before giving them a bath. In North India, like, most of the mothers, they do not even give bath to babies in winter for almost 2 to 3 weeks.
Yeah,
I mean,
that is a big myth again. It's not only North India, it's like universal in all the parts of India, everywhere in India. So we should not bath the baby like during winter and the rainy season. But we should bath the daily with a good warm, lukewarm water.
okay.
At least 4 times a week.
4 times a week?
At least.
Okay.
Yeah.
And it doesn't affect their health, it doesn't affect...
Not at all, not at all. So actually all the toxins, all the viruses from the skin can be removed with the proper bathing. Yeah.
So I totally understand that it just not only making them free from all the viruses and all these chemicals in their bodies, like definitely it's a part of the hygiene process, giving them a bath.
Personal hygiene.
It's a personal hygiene process for babies also. Moving forward, winters are specifically not really prone in other part of the India, like when we talk about south. Most of the times, I'm not really sure winter.
We do have winters, but we don't have snow. That's the thing. But we do have winters.
What kind of winters you have there?
Yeah, the same cold, but it is not extremely cold like...
The temperature goes down till...
like 20.
20?
Yeah. Not like 14 or 10.
14 or 10,
like in Delhi.
Okay, okay. So when we talk about hot climate states, again, south is not that hot climate, but a very monsoon friendly state. Does coconut oil work there as well?
Yes, everywhere.
Okay.
Irrespective of the temperature, everywhere it works.
Okay, okay. That's nice. Moving forward, Dr. Ajay, this is something which you have given like for the skincare essential and skincare tips. We also want to talk about and understand from you how nutrition is very important, just not only for toddlers and kids, but also for infants. We are, sometimes get really anxious and skeptical that how many times should I feed my newborn, how many times should I feed my a growing toddler. So there is a myth that in every hour a mother has to breastfeed or give a formula milk to infants, or there is also a myth that every 2-3 hours you have to give a proper food to a toddler or a growing kid because it's their development stage. So if you can share your expert advice with us.
It's a very good question actually. So after the baby is born, for initial 1 or 2 months, it should be like every 2 to 3 hours we have to feed the baby, because the newborn will sleep for like almost 16 to 18 hours. So we have to wake them up and feed the baby like every 2 to 3 hours. After the completion of 2nd month, it's like demand feeding, like every 4th hourly once, like 5th hourly once, so that the baby develops a good sucking and swallowing. So they can drink the milk within like 5 to 10 minutes and they can sleep off. Okay. So for only the newborn period, like initial 1 and 2 month only, it is like every 2 hours or every 3 hours. But after the 2nd month, it is like demand feeding. Whenever the baby needs milk, we have to give. Till 6 months, it is exclusively breastfeeding.
Okay. So when you mentioned demand feed, we should not get worried, like, if he's sleeping or she's sleeping for a longer duration and she is not demanding the feed. However, as a mother, I start feeling like, she has to and he needs to get milk. He needs that milk. If they are not waking up, so we should not get anxious. If when they will get hungry, they will definitely start crying.
Exactly. So when their tummy is full, they'll sleep for 3 to 4 hours. They'll never wake up. If the tummy is like not full, they'll wake up like in between, within an hour or within like 30 minutes. So if the baby gets adequate amount of milk, the baby will sleep for 3 to 4 hours. So we need not worry.
Dr. Ajay, I would like to know from you that there is a huge myth going on in our society. When a child is on breastfeed, he or she do not tends to get, gain weight a lot. But if an infant and a child is on formula feed, they usually gain weight. Is this true or false?
It is partially correct and partially false, because there is no comparison with the breast milk. Breast milk is the unique one. Whereas certain formula are trying to provide as close to the breast milk. Whereas some other brands in the market are like very cheaper version is having the products which should not be consumed by a newborn baby will have the effect on the weight. So they'll gain weight easily. So always when you are like feeling your milk is insufficient, you should consult the expert and get the proper brand and feed the baby with the formula, the best formula available in the market.
Dr. Ajay, can you help us understanding which formula is good or bad? I'm not saying that you mentioned bad formulas, but if you can help our community choosing from the best out of it, which brands you will recommend?
Yeah, personally, I believe 3 brands,
Okay.
Nan Pro and the Aptamil and Similac. These 3 are like almost 90% similar to breast milk.
Okay.
So I can strongly suggest these brands to the mothers who are like unable to feed their babies. Yeah.
So you definitely there is no comparison when it comes to the breast
Mothers.
milk, but you are saying that these brands do have a similarity, or 90%, 95% they are exactly like a breast milk, and they give proper nutrition to the baby.
Yes.
Okay.
Because the problem in India is from day one, if the mother is not having milk, they started feeding the cow's milk.
Yes.
So which is not good for the baby's gut.
Yeah.
So compared to that, certain formulas in our country are good.
Yeah.
So that is the other option. Yeah.
Since you mentioned that people are giving, not people, parents are getting pressure from their elders or from their grandparents that we need to feed a baby a cow milk or a buffalo milk. Do you advise us even to actually feed them with this cow and buffalo milk or not?
No. To be frank, cow's milk are only for calves, not for the infants. So ideally, we the humans drink milk every day. Whereas any other animals or any other creatures after the breastfeeding period, they never consume milk.
Dr. Ajay, is there any scientific reason that's why we are not giving cow's milk to babies?
Yes, exactly. There are certain reasons. Till 18 months of age, our baby's gut are not ready to accept the cow's milk, which has like higher amount of protein. There is a condition called cow's milk protein allergy. And other thing, it can cause iron deficiency anemia. So it is very difficult to feed babies these days. But if we are feeding the baby with a good amount of vegetables and fruits, and we'll give a glass of milk as well. So the milk will reduce the absorption of iron in the gut. So it can lead to iron deficiency anemia. And kid prefers to drink compared to eat. So it will be difficult for them to eat, whereas it will be easy for them to drink. So they prefer milk. And the parents are also ready to give milk anytime they ask. Because they believe milk is like a very good and rich
in protein.
Protein, yeah. But it is actually the opposite.
Okay. So what is the right age when we can start giving cow milk or a buffalo milk to kids?
So after 18 months of age.
18 months of age?
18 months, 1.5 years. Okay. Even certain recommendations are saying from 1 year of age we can start. But I personally believe it is better to start from 1.5 years of age.
Okay.
Because this thing happens. Okay. They prefer more of milk than the diet. So they will not get the adequate nutrition from the solids we are giving, like fruits, vegetables, dal. So they prefer milk. So I personally believe it should be started after 18 months of age.
Okay, and they're after 18 months, the kid digestive system is prone to
digest the proteins of the cow.
Yeah. Okay, all right, understood. So moving forward, Dr. Ajay, since flu is really a proactive disease for kids and for infants also, they usually get cold and they usually get a lot of severe flu also. So can you help us tell to how we can prevent our kids in catching flu and cold?
The first and foremost thing is a personal hygiene. Okay. To be precise, it's a hand hygiene. So we should make sure our kids wash their hands frequently, like before and after every feed, every time as many time as possible. Because hand is a source of multiple infection, and we should not allow our kids to touch their face. Nose and mouth are the major ports of entry of viruses and bacteria. So if the kids keep on touching the nose and mouth, all the viruses and bacteria in a hand will go inside. So they'll easily get the infection. So the first and foremost thing is the hand hygiene. And second one is diet, a proper balanced diet. So all the 3 meals should be a balanced diet with a carbohydrate, protein, fat and right amount of micronutrients. And the third one is adequate hydration, as I mentioned earlier. So proper amount of water intake is very important. It flushes out the toxins and all the unnecessary things from our body.
Understood. So
and the major part is the vaccination.
Okay.
The influenza vaccination.
Okay.
So till 1 year we have to give 2 doses of flu vaccine, one at 6 months and other at 7 months.
Okay.
From 2 years till 5 years, every year our kids should take 1 shot of influenza vaccine during the season.
During the season. And what exactly that month is?
July and August. So it will be right if they take at May or June.
Okay.
Yeah.
So Dr. Ajay, when we talk about these vaccinations, these vaccinations prevents babies from getting disease like malaria or dengue.
The flu vaccine is only for the influenza, that is a kind of virus. Influenza is different and malaria is different.
Okay.
Yeah.
So do we have any precaution or any prevention to save our child from malaria and dengue?
The same applies.
Same applies.
Yeah, hand hygiene, personal hygiene, adequate water intake and the proper nutrition.
Okay.
Yeah.
Dr. Ajay, what are the red flags in child development that parents should look out for?
Yeah, that's a very good question. Every parents have these doubts, but there are certain red flags, as you mentioned, that every parent should know. So if there is like no visual fixation by 2 months of age, and there are no vocalization, if the baby is not able to say any sounds, not able to make any sounds by 6 months. And the third one, the baby is not able to sit with support by 9 to 10 months. And the fourth one, the baby is not able to stand alone by 16 months.
Okay.
And the baby is not able to walk alone by 18 months. We can wait till 18 months for the kid to walk, because these days parents are expecting a 1-year-old kid to walk and run. And the last one, no imaginative play by 3 years. And if the child is not able to speak any single word by 18 months, this is a very important thing.
Okay, so
then it is a speech delay. Yeah.
And we should actually look out for all these symptoms and signs.
If you notice any of these signs, you should consult the pediatrician, and if the child needs therapy specifically for the speech delay or even for the developmental delay, the parent should consult the therapist as early as possible, because the brain growth is completed by 5 years of age.
Okay.
So 70% is completed by 2 years and 90% completed by 5 years. So as early as possible, if the child takes the proper therapy, there will be like 90 to 100% in the improvement. Whereas if they believe my child will develop, we can wait, then they'll surely end up in developmental delay.
Okay. So for an example, I'm sorry, I mean you were saying something. You said that a kid should start walking at the 18 months of
We
the
can
age.
wait till 18 months.
Till 18 months.
Yeah. Certain kid can walk by 12 months, other kids can walk by 16 months. Max we can wait till 18 months. The kid is not able to walk after 18 months, then it is a delay.
So,
then there should be a problem.
So how we can rectify that? Like there is a person in my family, and we have seen that boy growing up. I think it's almost 2.5 years and he's still not walking. So should we go to pediatrician?
And there are multiple causes. There are multiple causes to be looked out for. Is there any genetic condition, any other muscle problem, this muscular dystrophy? So many conditions are there. So always consult your pediatrician and get the personal opinion. Then we can take the therapy and treatment accordingly.
Okay.
But no point in keeping the child at the home and waiting for them to develop. Yeah.
So again, this is one of the thing, during the child development, we also tend to push babies and kids to start using baby walkers. Do you really think baby walkers actually help kid to take their first step and actually help them walk?
No, I'm totally against baby walkers. So it's a normal physiological process. Baby will do. So the baby can roll over. When the baby can crawl, the baby will walk automatically. They don't need any stimulator for the baby to walk. And moreover, it is more dangerous. There are high chance of injuries. And there is another study says there may be a chance of shortening, because when the child starts toe walking, if you put the baby on the walker, they'll start developing toe walking. They'll not walk.
On their toes.
Yeah, they'll not walk with a flat foot. So they'll end up in the tightening of the calf muscles. So it can affect their growth. So they might end up as a short-statured kid.
Okay, when you mention growth, it means like their height
Height,
can be
linear
shortened.
growth.
Oh, okay.
Yeah. So and the higher chance of injuries. These days, because the parents want the kid to put in the walker and they can do their work, though they'll be roaming around with the toe walking. So, but I'm totally against it. We don't need any stimulators for the baby to attain the normal things.
Okay. Let them actually walk on their own.
On their own.
Yeah.
They don't need any kind of things.
They don't want to hold anything. If they really want to walk, they will stand up themselves and they will
Even
start.
they'll keep the hands on the chair and they started walking it. They don't need any walkers.
Yeah. Understood. I mean, it's a great insight because it's not about actually parents wants to be free. However, they are not educated enough that these walkers aren't helpful for their. So I think it's a great insight.
I'll agree with you. Yeah.
There is no proper education and there is no proper notion about this, that these baby walkers are just it's like a toy. That's it. They're just making them happy and they're walking it. There are a lot of music. They're putting those buttons, but it isn't helping in their growth.
Yeah.
All right. Dr. Ajay, why nowadays kids are addictive to YouTube? Is there any science behind it?
Yes, there is a science behind it. That is something called dopamine trap.
Okay.
So there is a constant change of color while you watch YouTube.
Okay.
Whereas in real life reality, kids don't see. There's a constant change of color in the YouTube as well as in any screens. Whereas in reality, it doesn't happen. So the kids want that rush. So that dopamine keeps them addictive. So whenever they feel like doing something, they'll put the TV and watch the videos. Whereas in reality, it won't happen. That's why kids these days have reduced attention span. We are not able to control the kids and make them sit for at least an hour. Whereas our parents used to say, when I used to grow up, you people sit for an hour, 2 hours, but these days your kids are not able to sit. This is one of the major reasons behind this. Because they are constantly seeing the change of colors in the YouTube and other media. So they want the same thing in the reality, which is not possible. So there is a science behind it.
Okay, and I think these colors are also very loud. I mean, very warm tones of shades, blues and yellows, which is I think very catchable. Like kids can see these colors very easily, and it's very tempting.
That's the other thing. Kids get vision like us, like adult vision, they'll develop by 2 years of age. Before that, their eyes are not even fully developed. They will not able to see the proper image as like I'm seeing you and you're seeing me. So they'll see like a blurred image.
The blurry version.
Yeah. So by the end of 2 years only, they'll get a proper adult vision.
Okay.
So we should not show screens to them.
Yeah, not at all, I guess. Yes. I mean, when we talk about screen, I've been doing some research and I got to know that there are specific channels on YouTube by the name of Blue Way or Cocomelon also, that they actually shoot the entire content in such warm tones and such warm shades, which is again very tempting to babies and kids and also to dogs. So there are separate channels for the dogs
even
as well.
They do have certain color perceptions.
Okay.
Yeah. So they can see only particular colors. They'll not able to see as like we see.
Okay. Yeah. So I think dogs can see a blue color and green color, if I'm not wrong. Yeah. So
that blue-green tone.
Yeah. So I think YouTube is doing amazing job creating content for just not babies and kids, but also for dogs. Moving ahead, doctor, we were talking about child well-being and their upbringing, their development. I have a pet at home and I constantly poked by certain relatives and also my parents that why I'm having a pet with my child. I mean, he is small, it's dangerous to him, like he can swallow his hair, he is most of the time comes with a lot of, ticks or diseases. It is not good for your child development. Is this true or false? I mean, not false apparently, but what is your mindset about this?
Again, it is partially true because whenever the parents have allergy for the dog hair or cat hair, the baby might have developed it. But recent researchers says that whenever a mother is planning to become pregnant, they can buy a puppy or buy a cat or kitten. So
why is that?
So that the baby will get sensitized to that thing. So whenever the baby is born, he was already sensitized to the cat hair, dog hair. So there is no direct relationship between the dogs and the kids, unless otherwise if there is any issue in the personal hygiene of the dogs or cats.
Okay. So you mean to say that there is no such destruction if you're having a pet at home and you're having a baby simultaneously, they both can live together?
Yes.
And there is no intersection of any disease in between them?
There is no chance of infection provided the puppy and the kitten is vaccinated as well as the
babies.
babies.
So it's just a myth. I mean,
It's a myth. It's just a myth.
Okay. Moving forward, Dr. Ajay, we are talking about child's development. So, in today's scenario, there are a lot of ways how women actually get pregnant. One is the most common thing is IVF now, and it is actually known by everyone. A mother who is struggling getting pregnant normally, they chose artificial pregnancy and artificial fertilization. So, according to you, is there any difference in babies who actually get who actually born through IVF mechanism or a normal? There is a myth in society that a baby who is actually getting born through IVF mechanism and fertilization, artificial fertilization, they often catch cold and flu, and a baby who is born normally, they are healthy enough and they are not prone to catch flu and cold so often. So do you agree on this or?
No, actually I don't agree on this. So once the baby is born, there may be a complication for the IVF deliveries or IUI deliveries. There may be a chance of respiratory distress, that too immediately after the birth, most probably till 6 months. After 2 years, all the babies, either premature baby or a mature baby or a IVF baby or whatever, after 2 years, all the kids are same and they have the same level of immunity. It all depends on the proper nutrition. If the baby gets the proper nutrition, they will have the good immunity, they will not catch up the infections very frequently. It has no role with the mode of delivery or the mode of conception, getting pregnant.
Okay. So it's a complete myth, I guess.
Myth.
Okay. And I'm sure you must be getting a lot of concerns about this in your particular OPDs, in your clinic. Mothers usually come if she has a child at the age of 4 and 5, they often catch cold. Even I'm also struggling to find out, it's my baby's first winter, and I'm very skeptical that how I can prevent even him catching cold and flu. So if you can suggest few tips and tricks where I can keep my baby safe in first winter, and what are those points I should always keep in my mind, taking care of him in cold.
So before entering into the preventive tips, I just wanted to say something. So it is good to get infection, so by which the baby develops immunity. So it is okay to get the infection like every 2 months once or 3 months once, by which the baby develops immunity. The problem here in our country is they don't want a child to get fever. The parents immediately want the magic medicine to go the fever, to take off the fever. That is actually wrong. We should keep the baby for like 2 days, we have to wait. We have to just give paracetamol to reduce the fever, and we have to let the baby fight on their own. The WBCs in their body will fight against the virus. So by which the baby develops immunity called acquired immunity. But as a parents of India, we are not letting it happen. We go to doctor and we fight with doctor to get the antibiotics immediately. We don't want a baby to get fever. Fever is just a reaction to the infection. They should get fever, but we should make sure it does not go beyond a particular point, and we should have the consultation with the doctor. But I don't suggest to take antibiotics immediately.
Since you are talking about immunity, are there any foods available for our kids to consume, and it's good for immunity as well for them?
Yes. So we do have, Indian roots have very good vegetables and fruits. We can consume it, be it any season, winter or rainy season or summer season. Our baby should have one vegetable and one fruit and one egg in their diet every day, and the ghee. So all these 4 things can increase the immunity. So even the citrus fruits like vitamin C fruits like oranges can increase the immunity, and it also increases the absorption of iron. So vitamin C fruits, citrus fruits, oranges really helps during the cold time as well. So we should give fruits even if the baby is having like cough or cold, or even if the baby is having diarrhea, we can give fruits like oranges, bananas can be given.
Okay. Dr. Ajay, particularly a lot of dietitian and a nutritionist professional, they do not advise to give juice to babies or to kids. I mean, they certainly prefer them to eat raw fruit altogether instead of squeezing them and giving juice. What do you suggest
Yeah,
about
I
this?
agree with them. That is a good thing. Actually, eating fruit as such is a good thing because we'll get the dietary fiber. That is the only reason we are having fruits. They have all the micronutrients, all the dietary fibers if we consume it as a fruit. If you get the juice, you will get only the sucrose part, only the sugar part, the natural sugar of the fruit. We'll throw away the fibers and the vitamins, minerals, everything will gone. So it is better to consume as a fruit. So in between you can take juices like treats. We can take juices, that too are homemade juices without sugar, any form of sugar. Yeah.
I mean, I think it's a quite insightful, education to us. When we squeeze a fruit, all the fibers and the rich ingredients and the
will
nutrition,
go off. Only we drink the sucrose part.
yeah, which is completely sugar.
Sugar.
And it is even good for
It's
people.
of no use.
Okay.
Yeah.
Dr. Ajay, please also tell us that why, when we talk about sugar constraint, why it is not advisable to give sugar to babies up to 2 years of age?
Till 1 year, it is better to avoid salt, sugar, honey, and any form of sugar, like even jaggery. Till 1 year, it's better to avoid any form of sugar because sugar is always a sugar, be it in any form. After 1 year, we can take it in the minimal amount. We can take, even if it is a brown sugar or jaggery, any form of sugar can be taken after 1 year of age with a limited quantity.
Okay. I totally agree that sugar is not good for just not only for kids but even for adults. Also. I mean, sugar is big no to sugar. However, if we are not giving sugar and all this carbohydrate based vegetable and fat based fruits also and vegetables also and anything which is full with sugar and carbohydrates, how the baby will gain weight? I mean, we have seen so many babies who are underweight, though they are very active, they are very physically active, they are very emotionally active, but they are not chubby and they have a lean body.
Yeah, this is the very good question. Actually, carbohydrate have no role in the muscle growth. So what we actually want is a proper muscle and bone growth for the baby, not the chubby baby. And even people do believe sugar is the healthy thing to gain weight. It's not so. They need a proper protein intake. So protein is adequate for the muscle and bone development, not the carbohydrate part.
Not the carbohydrate.
So, and our Indian diet don't have proper amount of adequate amount of protein. So we do take meals, but it is not completely balanced. And moreover, any form of table sugar or refined sugar is not needed. We do have natural sugars, as you mentioned, in our fruits and vegetables. We do have carbohydrates. Carbohydrates are sugars. So there is no difference. What I am talking about is added sugar or additional sugar. So that is not needed. So we can get natural sugar from the dates, from the banana, from the sweet potato. We can get the natural sugar, natural carbohydrate. We don't need any additives like the sugar, table sugar or something like that. And moreover, our concern should be more on the protein, not on the carbohydrate. Then the baby will gain a proper adequate weight. They'll have a good future without any consequences like diabetes and hypertension in the future. Yeah.
Understood. Also, Dr. Ajay, you were mentioning about artificial sugars and artificial flavors. Post 6 months, when actually babies start eating, food, that milk thing's been over, you always start with Cerelac, and there are multiple brands which provide this beautiful formula, but 110%. There are added, flavors and fragrances and sugar in that. How we can avoid, our babies not to eat those brands and those products?
So as I mentioned earlier, from 6 months, our home food is the main thing. So a food which is like close to our roots and family, our traditional food. And moreover, I don't believe in the diet charts as well. So we do feed the baby with what we are eating, what our family have, what our Indian roots have. And moreover, these additives additional supplemental food like you mentioned Cerelac, some other form of food can be given as a supplement. That should not be given as a main food. Our major food should be what we are cooking at a home, like khichdi, dal rice, ragi. So mashed vegetables and mashed fruits, those should be the major thing. For the fortification of the minerals and vitamins, we can give this kind of food like once daily. That too, even I suggest to make homemade thing, like with our own nuts, millets, we can make it on our own. For the busy parents, they can buy these things.
You mentioned ghee, cow ghee. So is it advisable to give ghee to 6 months
Yes,
babies?
that's what I was about to tell you. From 6 months, only the dairy should be avoided. All the dairy products can be given. So it is fermented. It has all the good bacteria. You can give ghee, butter, curd, and cheese, paneer, because it all have the good bacteria, which is very good for the baby's gut. Whereas milk don't have, because milk is not fermented. So whereas from the curd we are making butter, from butter we are making ghee, then again we are making paneer. So these are all good for the baby's gut, which can be given. But it is totally the opposite in our country. People are like very fond of giving milk, whereas if I suggest ghee, they'll like it will create a problem to the baby's gut. How can I give ghee? So ghee has like lot of good fat and DHA. It helps in the baby's brain growth as well as the overall growth. Even I do suggest like use ghee for all the kids, not even any kind of oil. Ghee, even for the tempering, even for the cooking, whatever, use desi ghee.
Use desi ghee.
Yeah.
I think desi ghee, it's a very underrated nutritional fact.
Because of the westernization.
Because of the westernization. So
Because of all the refined oils came into the market that created the thing that ghee has more fat, it causes heart attack, and they've created the reverse myth.
I think it's a reverse myth, because all these foreigner western oils, they are saturated. They contains a lot of saturated fats. Yeah. Okay, I understood. Moving forward, Dr. Ajay, there is a really interesting topic I would like to discuss, which is parenting. We as a mother, we as women are very emotionally connected with our child. Of course, we understand that we have given birth to him or her, and he or she becomes a part of our body. I mean, just not only a mindset, our body. I mean, if he feels or she feels any sort of a problem, mother is always instinctive and she wakes up. I'm a kind of a person who is a घोड़े बेच के सोने वाला बंदा. I mean, I'm not really sure that how I should pronounce in English, but when I sleep, I sleep. I never I was not even entertained by anyone like I should wake up so early or I get up. But since my baby was born and he is sleeping besides me, if he even takes a turn also, I wake up. So that's how the connection of a mother is built up with their child. It becomes a part of her body. However, when we talk about men, papa, they takes time to connect with the baby. But what kind of an advice you would like to give to new parents, not only parents,
To fathers.
to father, what kind of an advice you would like to give to a new papa or a new dad to look after and to actually help supporting his better half?
Yeah. Becoming a father is also a challenging thing for the men as well. Still, the parenting should start from the day one of conception. It's not from the day the baby borns. From the day one of conception, the father, the husband should be with the mother, and he should take the mother to every gynec visits, and he should take care of the mother. After the baby borns, the father should take the baby with the mother to the pediatrician. So for all the pediatric regular visits and the vaccinations as well. Whenever I go to clinic, I always see mothers. I rarely see fathers in my OPD. So I used to ask them, so where are the fathers? Why you people are coming alone with the baby? So that is the only thing. For every pediatric visits, you should go. Every father should go with the mother. And certain small things, it might sound silly, but changing the diaper in the night times and helping the mother in positioning the baby while breastfeeding. And when the mother needs a break in the me time, the father should take the baby and he should give the skin to skin contact. It will create more bond. Even the recent researchers says the bond between the father and the kid is much more effective than the mother's bond. So the parenting by father is very important, and it has a huge impact on the child's future. So they should start from the day one of conception, not from the children that's going to the school, picking up from the school. It's not like that anymore.
Yeah. No, I think it's a great validation for parents to accept that it is just not only mom's duty, it is also father's duty to take care of a child. And you correctly mentioned it is not about taking her to the vaccination. It is also about that kind of a bond creating with your child. It's just not only mom, it has to be a papa there always. And it's good. Why? Because if you will start implementing from day one, your baby, when he will comes to that age, he will also realize that my father was standing behind me since I was born.
And don't get offended. And one more researcher says that the baby grows more with the father, will have a high IQ and high cognition.
Very nice. So I'm done.
So every mother should involve the fathers in the parenting
That's a
to have
great sense.
a like intelligent kid in future.
Yeah, see, please listen, all fathers. If a child is going to be with you, they will have high IQ and cognitive abilities.
Yes.
Very nice. Why is that, by the way? I mean, I think mothers are more intelligent than men, than father.
It was actually, the reason was unknown, but the multiple studies are saying so.
Okay. I think the source is actually making bluff.
Actually, I quote those researchers, but it will be
It's
like
very nice. I know it's something which is very good. So I think this research has been done by men itself.
Yeah.
That is the reason.
because most of the researchers know.
Done by
yeah,
men. Oh, okay. So
headed by the men.
So you are saying that men are more intelligent than women?
But anyway, at the end, they should take care of the baby. They should involve in parenting.
Yes.
Whatever.
Doesn't
it is.
even matter if they're intelligent or they're
or
stupid.
not. They should be involving in parenting as well.
No. Small things actually makes a lot of difference,
So
Dr.
that is the
Ajay.
conclusion. Whether
It's because I feel like, when women deliver the baby, her body actually, throttle into multiple pieces. It just, however it happened, it is through normal delivery or through C-section. It's a toll on her body. I mean,
yes.
producing a baby.
Kind of anxiety and depression is the same, whether it may be a normal delivery or a C-section or any kind or any mode.
Yeah. So postpartum depression is actually, it's an assertive thing. It's very real. I have suffered myself. I may have not suffered it in a very dramatical way, but yes, I started feeling like very lonely. I started feeling like it's all me. My husband is not taking care of the baby in night. Why all the time I'm waking up, like, it's 4
You are the
a.m.
only one to take care all the time.
Yeah. So it's I think I totally appreciate and I totally
should change. That too, in our
recommend
country,
this.
that should change.
That should change. Correctly mentioned. Since the women start conceiving from the day one, it should start the parenting way. Yeah. Moving forward, Dr. Ajay, again, as you mentioned that parenting is very vocal nowadays. I mean, in corporate environment also, just not only maternity leaves are getting approved, parents as a male also you are getting parenting leave. Paternity leaves. Yeah. Since this parenting, particular topic is huge. I mean, it starts from day one and it goes till the age of his life, even if he or she gets married also. But I would like to understand from you, parenting isn't easy. I mean, in every age, it isn't easy. But parenting actually gets more difficult when the kid is growing 3-4 years old, 5 years old. They become, persistent about the things they want. They become stubborn. Persistent is a very positive way to say this, but they become stubborn. What kind of advice you would like to give to parents at that
here
age?
I only should give advice to the parents, because it is not always about the kids. Parenting is always about parents as well as the kids.
Yeah.
So while the baby grows, we should also grow. Like, we should groom ourselves. Like, we should take everything positively. We should develop patience. Parenting is a learning process. So by the time they are like very stubborn, we should be like very patient enough to handle them. So we should groom ourselves physically as well as psychologically to take care of such things.
I think it's a development on both sides.
Both sides, exactly.
Okay. Like, baby is growing, kid is growing. You need to grow yourself too. You need to understand, you need to spend more time with your child, start developing that habit of understanding whatever they are saying or whatever they want. I totally agree. Like, it's a development on the both side. Yeah.
It's a two-way process.
It's a two-way process, yes. Dr. Ajay, obesity is a big topic globally. I mean, there are few studies by UNICEF also, by WHO also, that obesity in any way is not good for any person, just not only for kids or toddlers or infant, for anyone. Uh, in India, do you realize or do you start believing that kids are getting more obese nowadays?
So obesity is the major problem in India because of the more westernization. So we rely more on the processed and ultra processed food. Whenever it comes to a snack time or when we are going out, we always rely more on the junk foods like pizzas, hot dogs, burgers whenever we go to mall, and whenever we go to supermarkets they'll buy all these kind of chips and biscuits.
Packed foods.
Packed foods. So whichever food which has like a long shelf life, it's not good for our body. So these are all the major cause for the obesity, and the second most cause is the screen time, watching TV and eating. So the kids didn't even know the texture, didn't even know the taste. Whenever you put TV and you feed whatever you can feed, it will go inside.
True.
And they don't even know the quantity and the quality of the thing, and they'll never feel the taste, they never feel the texture. So these are all the causes for the obesity these days.
The actual true meaning of a couch potato is you actually become a potato.
But
Yeah, I mean it's meant for not babies and kids but also for adults as well. Dr. Ajay, I have seen, I wouldn't say it's a revolution, but I have seen on Instagram nowadays that there are kids who are actually taking, you know, these brands on a very offensive manner. I'm talking about young kids up to age of 8 years, 7 years old, and they are telling to users through social media reach that these packed foods are not good, and I'm really happy seeing these children advocating about it.
it's a very good thing, it's a very good change, it's a big change.
It's a big change, and it just not only shows like, you know, an enthusiasm from their end, but also educating millions and millions of children.
Even people do ask me, what kind of snacks you want me to provide, doctor, other than chips and biscuits. Even they are like fond of chips, biscuits. They don't know that we can give a cup of vegetable or a cup of fruits, or we can give a cup of soaked nuts. We can make like our traditional foods, and we can give as a snack. So snack is not only the packaged food, and as well as the Tetra Pak juices, the carbonated drinks.
Oh yes,
that is the other big thing. Yeah, it's a big no for all carbonated drinks that comes in the packet or the Tetra Pak.
So I understand, you know, these snacks are not good for kids and not good for us also. Apparently internet has become like, you know, a resource where you can find so many things related to bad food also, good food also. However, if anybody would like to give good snacks, healthy snacks to their children, they can find out numerous cooking shows and you know, recipes. I think you also
organic brands
talk about
are also there.
Yeah.
And we can make their own recipe at the home. If they don't have time, many organic brands are there. They can go for that.
I think it is always advisable, like, you know, if your child is insisting for chili potato, it's better to make chili potato at home. Yeah. So yes, gradually we will you know, educate more and more people, and there will be a change in system, of course.
Surely there should be a change.
Healthy Indian will be there, and healthy Bharat will be there.
So we were healthy before.
Yeah, we were healthy
in
before.
between the westernization comes
Came,
in.
Yeah, I still remember, like you talk about year 2005 or 2000, the only fast food we were aware about was South Indian. I mean, if you have to go out for a party, you only eat dosa. I mean, maximum to maximum chow mein. It
It's
used
the
to call
opposite
chow
in
mein.
South, whereas we go for a pani puri and the chaat.
Pani puri and the chaat,
Samosa chaat.
Yeah, so in North I'm talking about, the only fast food we knew was dosa or chow mein. It won't even called noodles at that point of a time. Now I have a range of a noodle, Hakka noodles, Singaporean noodles, Chingy noodles, XYZ noodles, blow noodles, whatever. So yes, the modernization and the westernization has been adapted in the market and in the society, but these pizzas and pastas are not good for kids.
It's not good for Indians. It is good for Italians.
Yeah.
So we should rely on our own food, our roots.
So Italian people, they walk so much.
Yeah, and what the problem behind our obesity in India is, because we don't consume more vegetable and fruits. Whereas they'll eat like a bowl of salad and they'll eat 2 pieces of pizzas.
Yeah.
So they won't harm, they won't get the harm from the pizzas. Whereas we'll eat like 6 pieces of pizzas and we'll never take any kind of vegetables. We'll never take any kind of fruits. That's the problem with us.
And we don't exercise too. That's what I'm saying. When you talk about Italy, there is a beautiful place in Italy called Florence, and there are no, subways, and there are no metros. People walk over there.
Yeah,
and
in
if
Europe
they're-
they walk.
They walk. If they are eating unhealthy food, so they are also taking care of their body in terms of exercise and in terms of walking. What we do, I mean, we eat McDonald's ka burger and we sit on a couch and we become a couch potato, as I said. Moving forward, we were talking about kids and their healthy habits. We also want to discuss about a very, very crucial topic, that is Down syndrome. I see a lot of babies suffering from these, how should I pronounce it? I mean, this is a disease or it's a
syndrome.
It's a syndrome. It's a birth defect.
Defect. It's not a disease.
It's not a disease. It's a birth defect. It's a syndrome. Why this happened? Because this is not something which happened after the pregnancy. I think this particular syndrome comes when a mother is expecting a child itself, and by birth only they get it. Why this happened?
There is one major proven risk factor is elderly primate, getting pregnant after 35 years. So that is one of the major risk factors for Down syndrome. So getting late pregnancy, that is one of the major risk factors. Okay. Apart from that, there are many other genetical reasons are there. Still, we can identify this condition in utero. Like when you're doing the scans, we can able to get the thing, whether the baby is normally developed or is it a Down syndrome. And we have multiple tests these days, like triple marker, quadruple markers. From that, we can come to know that your baby is a normal baby or a Down baby. Then we can decide on it.
How we want to continue.
How we want to take this forward. Yeah.
But this Down syndrome, since you said that we can acknowledge it, that because of these new technologies and new X-rays and tests, you can find out that your baby is Down syndrome or a normal. However, because she is a mother, she anyway wants a child. So is there any way where we can treat this defect?
As I mentioned earlier, this is not a disease to treat. It is a syndrome. It is a combination of multiple conditions.
It's not.
Yeah, it is not treatable. We can give additional supports.
Okay.
To the baby grow normally. Yeah. Whereas we cannot completely cure because it is not a disease. It is a condition. We cannot cure. We can support the baby. We have like Down syndrome group, like a parents group. We have a particular hospitals and the therapy centers for the Down syndrome kids. Even people with Down syndrome are working and earning these days. Yeah. So it's not a big thing.
Yeah. So Down syndrome is like they are different from normal children.
Exactly. To be scientifically, to take a note on this, usually humans do have 23 pairs of chromosomes. So whereas in Down syndrome, we have like 47. Ideally 23 pairs is 46. In Down syndrome, there will be extra copy of chromosomes. The kid will have extra one chromosome. They will be having 47 chromosomes. So that is the basis of genetics, the Down syndrome.
So Dr. Ajay, what I have seen and what I have encountered, I am no expert in this, but whenever I see any child with this syndrome, and whenever I see another child with a normal efficiency, all these children with Down syndrome has same sort of a facial integration. They are very similar to each other.
Yes, we can easily identify. Anyone can identify the Downs because the common features like they have a short ears, short neck, flat faces, depressed nasal bridge, upward eye slant. So these are all the common features. Anyone can easily identify the baby is syndromic.
Okay, so I think these features are common in that.
One most important thing is they are like happy faces. They always laugh at you. Not like any other kid. Whenever you see a Down's baby, they laugh at you. Yeah.
So okay.
That's a very good part of the Down syndrome.
Okay, they always laugh.
Yeah, they always laugh, not like any other kids.
Yeah. No, very nice.
Yeah.
Thank you so much, Dr. Ajay, to be here with us. It was such a great pleasure to have you here and to understand all your expertise related to parenting, child nutrition. It was an insightful conversation, and we look forward for more podcasts with you.
Yeah, thank you. Thank you so much for this wonderful opportunity. It's a very good initiative by the Baby Forest.
Thank you.
Yeah.
Thank you so much.